Extract 1. Questions 1 to 12. You hear a dietitian to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please have a seat. What brings you in today?
Hi, Mr. Green. Thanks. It's this belly fat. It's just gotten out of control.
I understand. Can you tell me a little more about it?
Well, it's been gradually building for a couple of years, but it's definitely gotten worse recently. These love handles are just awful. People even make comments sometimes, which is embarrassing.
Absolutely. How has this affected your life?
I can't wear clothes I used to like, especially slim fit styles. I feel older than I am, and even simple activities leave me out of breath.
I see. Have you tried anything to manage your weight, Mihiraa? Medications, perhaps?
No meds, but I've been all over the place. Joining the gym, trying yoga, it's hard to stay consistent. I even considered the keto diet, but it seems too restrictive.
Right. Before we discuss any specific diets, it's important to understand your overall health picture. Do you have any existing medical conditions?
Actually, yes. My blood uric acid levels run a bit high.
Noted. And is there any family history of weight-related conditions like diabetes?
Yes, sadly, my mother has type 2 diabetes.
Thank you, Mihiraa. Now, tell me about your typical day. What kind of work do you do?
I work for the government, so it's mostly a desk job.
Okay. Could you describe your lifestyle habits?
Honestly, I confess, I have a bit of a sweet tooth. Pastries, sugary drinks, you name it.
And do you eat out often?
All the time. I love trying new cuisines and exploring flavors. But maybe that's part of the problem.
It's certainly something to consider. Mihiraa, while I understand your desire for a quick fix, drastic diets often backfire. Let's focus on making sustainable changes. A personalized meal plan can be developed, but it should be gradual. It takes time to establish healthy habits.
Makes sense. But how do I deal with this belly fat first?
Well, along with a balanced diet, exercise plays a crucial role. I recommend consulting a certified physical instructor. They can create a safe and effective weight training program tailored to your needs.
A weight trainer? Okay, that sounds doable.
Excellent. We can collaborate to help you achieve a healthier lifestyle. Would you like to schedule a follow-up appointment to discuss your new diet plan in detail?
Absolutely. Thanks so much for your help, Mr. Green.
You're welcome, Mihiraa. Remember, it's a journey, not a race. Let's take things one step at a time. With systematic management, you will be able to achieve your goal.
Extract 2. Questions 13 to 24. You hear an optometrist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, have a seat. What brings you in today?
Thank you. My eyes have been feeling quite gritty lately. It's like there's sand in them.
I see. Are there any other symptoms you've noticed? Does your eyes feel itchy or red?
Yes, actually, they do itch sometimes. Especially towards the end of the day. And sometimes my vision gets a little blurry after I've been working on the computer for a while.
Interesting. Mihiraa, have you tried anything to manage these symptoms? Any eye drops or home remedies?
I've been using some artificial tears I bought at the pharmacy, but they don't seem to last very long.
Okay. Do you spend a lot of time working on a computer?
Yes, I do. I'm a software developer, so I'm staring at screens most of the day.
And is your workspace air-conditioned? Mihiraa, does it have a lot of bright overhead lights, or blue light-emitting devices like additional monitors or phones?
Yes, it is quite cool in the office. And there are a lot of fluorescent lights, especially since I have multiple computer monitors.
Alright. Now, let me ask you a few questions about your medical history. Have you ever been diagnosed with any eye conditions before?
No, I haven't had any eye problems before.
What about in the family?
My grandmother did have cataracts though.
Thank you, Mihiraa. Based on your symptoms and the environment you work in, it seems likely that you're experiencing dry eye.
What does that mean?
It is a condition where your eyes don't produce enough tears, or the quality of your tears isn't sufficient to keep your eyes lubricated. This can lead to grittiness, redness, and blurry vision, especially after prolonged screen use.
Oh, that makes sense. So, what can I do to feel better?
We can explore lifestyle adjustments to ease the symptoms, Mihiraa. Begin by incorporating regular breaks from screen time. Every 20 minutes, take at least a 20-second break to focus on distant objects. This simple practice effectively alleviates eye strain.
Okay, that sounds doable.
Additionally, we can optimize your computer workspace to alleviate dry eye symptoms. This may involve minimizing screen glare and adjusting the humidity level in the room, if it feels excessively dry.
Okay.
I can also prescribe some medicated eye drops that will help keep your eyes lubricated throughout the day. I'd like to see you back in a month to monitor your progress.
Great, thank you so much, Dr. Jane. I feel much better knowing what's going on. But well, what if I can't fix it?
If left untreated, severe dry eye can lead to complications such as corneal damage, increased risk of eye infections, and even vision impairment. Mihiraa, it's essential to address dry eye symptoms promptly to prevent potential long-term consequences.